it's my pleasure to welcome all of you. Before we started, I did want to say that Rethink is hosting this meeting virtually, and we acknowledge that our office is on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit and the Williams Treaty signed with multiple Mississaugas and Chippewa bands. And now to introduce today's speaker, Katie Hauk. Katie is a registered physiotherapist who specializes in pelvic floor physiotherapy with a special interest in the impact of cancer treatment on pelvic health. She comes to us from Toronto Physiotherapy, and if you remember, some of you might have been at our session we did with Lindsay Davey, who works in the same practice. And Katie knows a thing or two on how common cancer treatments can impact one's bladder, bowel, and sexual health. Katie's passionate about sharing her knowledge and delving into traditionally uncomfortable yet significant health topics. We were just saying how great it is to have these sessions we've been doing where we can cover some topics that maybe haven't been discussed enough. And with that, I'd like to say welcome to Katie Hauk.
Hey, thanks for having me. So I guess, are we sharing the screen from now?
Yes. Go ahead and share.
All right. Where we go. Yeah, I know when we think about breast cancer treatment, a lot of the focus tends to be upper half of the body. Anything below the belt often doesn't get a lot of airtime. So I am happy to also leave my email at the end. Feel free to ask me questions at any time over email, especially as we get into kind of more traditionally taboo type of topics. So hopefully next little bit we'll cover the who, what, when, where, why, how of the pelvic floor and why we may be considering the pelvic floor when we think of breast cancer treatment. Well, the reason why breast cancer treatment can impact the pelvic floor, we're focusing a lot on estrogen. So typically the estrogen either declining or in some cases complete removal of estrogen from the body basically has menopause-like effects. And it doesn't matter whether it was from hormone therapies or naturally occurring menopause in late 40s to early 50s, the effects can all be the same. So particularly with hormone therapies, aromatase inhibitors are about twice as likely to have side effects of the estrogen decline. And when we combine chemotherapy and hormone therapy together, it can actually induce menopause in about 80% of what would have been premenopausal women within 1 year of that treatment. So with kinds of symptoms, they are the menopause symptoms. When I was looking up a picture to add to this page, all the pictures were someone standing in front of a fan or with a handheld fan trying to fan themselves. So probably heard of hot flashes. This is the symptom that often gets a lot of airtime. Considering about 75% of us in menopause are going to have hot flashes, there's a reason it does get more attention. That being said, there are a slew of physical and emotional symptoms that we can experience from menopause. Not every woman's going to experience the whole list. It could be any combination of them. So for our purposes today, for ones that we can have an impact on, is focusing more on the vaginal changes. So painful sex being a big area, and then the bladder changes as well. So overactive bladder, bladder leaks or incontinence, and urinary tract infections we can cover on the next couple slides. Now, as estrogen declines from that hormone treatment, this creates vaginal atrophy. which is basically thinning, drying, inflammation of that vaginal lining. Usually when we get that thinning, drying, dryness is the main symptom that we can experience. Nearly half of women with breast cancer, dryness is going to be a big symptom that we're looking at. If you look at the picture on the very bottom, on the left-hand side, that's kind of typical vaginal tissue. You can see it's quite thick. There's lots of folds, lots of layers. Best comparison I've heard for this is the left-hand side is like a 1950s poodle skirt. It's something that you can move in. There's going to be lots of freedom. You could do the splits if you wanted it. There's lots of flexibility. Versus the picture on the right-hand side, that's more like wearing a pencil skirt. It's a lot tighter. There's going to be less movement. The vaginal walls actually do shrink and shorten. So you get actual shrinkage of the vagina with these estrogen type changes. Well, estrogen also does have an impact on pain threshold. So it can lower pain threshold as that estrogen declines, which means we can experience more symptoms of burning. When we add that into the shrinkage of the vagina, the narrowing and shortening, that can lead to pain. So particularly pain on penetrative intercourse. So that might be during sex. It could be pain with orgasm. It could be hours or days later. Whatever the pain is, this has this added effect of creating a protective response in muscles. So particularly with our pelvic floor muscles, our body wants to protect us. One way it protects us is by tensing muscles. When we tense muscles, we then increase more pain. Now we're stuck in this vicious cycle or loop of pain and tension. And again, not as much people experience this as, say, the hot flashes, but it's still almost about half of breast cancer survivors that experience pain. A lot of our physiotherapist strategies or solutions are aimed at finding a way to cut through that pain and tension vicious cycle loop. Well, when it comes to the bladder, if you're the person on that road trip, back when we would have road trips or long plane rides, if you're the person that was having to stop at every single rest stop to pee, the bladder changes might be something that's of interest to you. So our bladder and pelvic floor, they do work very closely together. When we have that tension in the muscles and add on that sensitivity of the nerves when estrogen declined, this can create a trigger to the bladder. So symptoms that you might notice is that strong urge to go, even if you just went to the washroom. If you're that person going every single stop or every hour, getting up at night to pee, unless you're over 50, getting up once a night is typically normal. And then loss of control of the bladder. If you're on your way to the washroom, you're rushing, don't quite make it in time, these are all symptoms of tension in that pelvic floor. And last but not least, the estrogen does have a supportive function on the immune system. So it does support our immune system in the bladder and the urinary tract. Different areas in our body, they like a certain environment. So there is something called our pH level. 7 is sort of a neutral pH. So this is how acidic or how basic an environment is. Water is a neutral, so that's a 7. Blood running through our body is roughly around a 7 as well. Our vagina actually likes more of an acidic environment. So sometimes our vagina is referred to as a self-cleaning oven. If you think of cleaning solutions you use in your kitchen, vinegar, it's a little more on the acidic side. The vagina is also more on the acidic side. So this is an environment that helps support good kind of protective bacteria that's going to battle out that bad bacteria like E. coli. When estrogen drops down, our pH level actually starts to become more basic and starts to rise. So that good bacteria can be killed off in the process, leaving a good environment for bad bacteria to thrive. So how do we go about managing or treating these pelvic health effects from that decline in estrogen? So next couple slides, we can chat about local estrogen, moisturizers, lubricants, more the hands-on piece, exercises, and last but not least, preventing urinary tract infections. So it would make sense if all the symptoms or side effects are from estrogen being declined or removed from the body. If we add estrogen back in, the symptoms would improve. This is an effective and safe treatment for menopause symptoms in most women. They do come in different forms. As of right now, there's a limited number of studies looking at the effects in breast cancer. So with the different forms of estrogen, there's been some positive studies so far looking at ultra low doses that is applied locally. So whether that's a cream, a tablet that's inserted, or a gel. Where the concern is if the estrogen starts to circulate throughout the body and get into your bloodstream. Particularly with cancers that are estrogen receptor positive and use estrogen as a fuel, we're looking to keep that estrogen locally rather than having it circulate throughout. If this is something that you are looking into or considering, having your doctor or specialist on your team to chat with is a great option to explore. If estrogen is not an option or something that you're not considering, moisturizers and lubricants are a great way to battle that common symptom of dryness from vaginal atrophy. Well, moisturizers, just like we moisturize our skin every day in cold, dry winter months, we can use moisturizers for the vagina as well. Just like we moisturize our skin, there's something that you would use regularly. And they come in lots of different forms of creams or suppositories and natural oils as well. Lubricants are another option that you can use during sex as a tool to help break through that pain, creating tension, vicious cycle. There's water-based, oil-based, silicone-based. Not all lubricants are created equally. Any lubricant you're looking for is ideally one that doesn't have a lot of chemicals or additives to it that are going to irritate that more sensitive tissue in the area. Water-based typically tend to be ones that don't have a lot of irritating chemicals, but even then, you're looking for one too that's going to match that natural environment in the vagina. So that pH level, so that slightly acidic level, you're looking for your lubricant to be roughly within that range as well. So the vagina tends to be between about 3.8 to 4.5. Some great ones that tend to be good go-tos are slippery stuff, yes, and liquid. Unfortunately, a lot of the great ones tend to be not as commonly available at drugstores. Someone did put together a really great but kind of involved and crazy chart of some lubricants that you might find out there and what are their pH levels. So you can see in that orange column, looking for something that's matching that vaginal environment. Try and stay away from ones that are on that really high number side. That might increase that pH in the area and kill off some of that good bacteria. So who can also help on your team? If you're looking for physiotherapists, so physiotherapists, they perform a lot of hands-on treatment So particularly mentioned tension in muscles is a big piece for that painful sex and those bladder concerns. So someone that can work on tender points and tightness in connective tissue and pelvic floor is a good resource to have on your team. Just like if we have a tight neck, so knots in our shoulder, and we put tension on those knots to get rid of pain, physiotherapists can help you do the same thing with the pelvic floor. When you're looking for a physiotherapist, the training are courses that are done after graduating in a special area of pelvic health. If you're looking for someone in Ontario, there's a great website and resource called Pelvic Health Solutions. So it lists most of the Ontario physiotherapists that have special training in pelvic floor health. As another option, but not a general rule, they did a couple years ago start offering a course in oncology or cancer and pelvic floor. So that might be something to look at if you're considering a physio in your area. More of a guideline, not a general rule. There's some physios that may have done some additional training on their own or a course that wasn't offered through Pelvic Health Solutions as well. In addition to hands-on treatment with a physio, they might recommend or guide you to some good tools you can use at home to work on muscles. So their ones are like the picture on the left-hand side at the bottom is basically a very funky poking device as an option to work on some of those muscles in the pelvic floor. For that narrowing and shortening of the vagina that happens with the estrogen changes, dilators show some great evidence for trying to get that more elastic skirt feeling back again. And exercise is truly the best medicine. As physio, if you've been to physiotherapy before, you can't get away from exercise. Not only does it have great effects on reducing the reoccurrence of cancer, there can be great local impacts on the pelvic floor as well. So any kind of exercise that gets your heart rate going, it's the same guidelines as we would have for any other type of exercise. And there were additional benefits that were shown from adding some strength exercise in about 2 times a week. Sex often is great for the pelvic floor. So orgasm does improve blood flow, bring nutrients back to the vulvar tissues, can also help keep things a little more liquid, help with dryness. It's a bit of a catch-22. If you're someone that's experienced pain with sex, now we're feeding back into that vicious cycle of the sex is going to increase tension, and then tension increases pain. So another area that we do look at before we go into more specific exercises for the pelvic floor, we could do lots and lots of hands-on treatment, working on tension, getting rid of those tight spots. But if the nervous system is in its protection mode, we're just going to go back to the same result. So our nervous system or our brain is truly the queen of everything in the body. With seeing a physiotherapist, they can help guide you into better connecting to the pelvic floor. From there on, it's more about checking in with your pelvic floor throughout the day. I don't know about you guys, but how many of you actually stop midday and think of what the pelvic floor is doing? Is it relaxed? Is it holding on to tension? More often than not, we could be holding on to tension without even noticing that we're doing it. So working on visualizing that pelvic floor, trying to release tension throughout the day. There's some great visuals out there, like pretending you're dropping your underwear or flower opening. that are just ways for our brain to reconnect to that pelvic floor and check in on what it's doing in the day. Lots of great evidence out there for yoga, tai chi, qigong, anything that kind of gets the body moving. And even something as simple as 5 minutes of deep breathing in a day is enough to tap into our kind of rest and digest nervous system. So the nervous system that's really responsible for releasing that tension in the pelvic floor. Once our brain's on our side, more specific exercises for the pelvic floor can have a better impact. So whether that's lengthening or getting rid of those tight spots in the muscle, decreasing tone, that's when exercises like reverse Kegels or releasing tension can come into play, as well as things like full squats or other mobility exercises. So all ones that are working on trying to reduce some of that muscle tension. Retrain the pelvic floor muscles may also involve Kegels. As we know, as estrogen does drop, we can also lose some muscle strength or muscle function as well. So physios can really help guide kind of a suitable tailored home program on whether you're looking at reducing muscle tone or trying to strengthen muscle tone, or a combination of the two. So preventing UTIs, there's a lot of great tips and tricks out there. It's often easier to prevent than treat. So you've probably seen lots of tips around drinking water. Emptying bladder after sex can be a great tip because semen is a little more basic, which doesn't match up with our acidic self-cleaning oven vagina. Having a naturopath on your rehab dream team can be another great resource for providing tailored advice around preventing UTIs. So feel free after today, my email is here. Ask me questions at any time. I know Lindsay, we joke, she's everything from waist up. I'm everything from waist down. So we're happy to answer your questions covering the whole body.
Thank you so much. All right. That was great. So I feel like you answered actually a lot of the questions that we got in advance. A lot of questions, does cancer treatment cause yeast infections or UTIs? Always lots of questions about painful sex. So I feel like you covered a lot, but I realized, we kind of jumped right into your presentation and just introduced you as a pelvic floor expert, but that's actually kind of a new, unfamiliar term. So, there's gynecologists, urologists, urogynecologists. How does a pelvic floor specialist fit in and in that kind of healthcare profession? Where do you sit?
Yeah, so physiotherapists, we're mainly focused in on muscle. So looking at movement, muscles, and how they might be contributing to some of your symptoms. Versus if you've seen a gynecologist, they're looking more in at the organs. So the bladder, vagina, and that side of things.
Okay, well, that's interesting. Yeah, thank you. Sort of a connected question is maybe could you walk us through what a very first exam or assessment would look like? Because I know when I go to the physiotherapist, maybe I'm in my Lulu pants, or maybe they give you a pair of shorts. You might be on a bench and there's other people having treatments as well. Maybe you're in a private room. It depends where you go. And if it's sports physio, it's pretty like bodies everywhere. This seems more intimate. Is it like, are you stripping down? Are you examining things? How does it work? Just the overall, like, give people a picture of what an assessment would even be like.
Yeah, it's a great question. When you think of physiotherapy, it's not often your typical picture that you're thinking of when you're going in for a treatment. So like other physiotherapy, we do ask the bunch of annoying questions first. We do go through a hands-on exam. The hands-on exam is going to look a little bit different. So I did bring one of my pelvic floors to kind of explain. This is what I would typically go through with someone that is coming in. So knowing a bit of anatomy first, pubic bone being on the front, tailbone being at the back, bladder openings, the really tiny guy there. We have vaginal opening and then rectal opening. So part of a exam, when we're looking at pelvic floor muscles, we have a couple on the outside, but we have a whole ton of them on the inside. Only way we know what a muscle is doing is to be able to feel it. Just like if you had your shoulder examined, they would be feeling the muscles, moving things around. Pelvic floor muscles, like any other muscle.
So it is an internal exam.
So you got it, yeah. So it's an internal, vaginal and or rectal exam to be able to feel the muscles and look at strength.
Okay.
So it is a private treatment room, as you might expect, versus the more kind of sports open environment type of setup.
Okay. Great. All right. Well, I'm going to go to a couple of questions that have been asked. Someone's wondering if you can elaborate on what a reverse Kegel is.
Yes. Yeah. So Kegels are often the one that gets a bit more airtime. They're your strengthening exercise for the pelvic floor. Reverse Kegel is the opposite. So it's strategies and ways to, instead of strengthening up the muscles, to release them with tension. It's essentially a fancy term for breathing techniques. Our breath is a very powerful tool and probably the exercise that I teach the most often. Part of why our breathing is so powerful is our diaphragm, pelvic floor work very closely together. So we think of our diaphragm up here, our pelvic floor is below it. When we take a deep breath in, if we're breathing with our diaphragm, it's going to move down, create pressure, pelvic floor is going to release with it. So it can be a bit of a fine-tuning individual strategy, trying to find ways that tap into that diaphragm, visualize that pelvic floor to release and drop some of that tension.
So I know with physiotherapy for other, injuries or issues, there can be some home rehabilitation to do, and that's what is going to improve the situation.
Mm-hmm.
So my question is kind of like, someone comes and sees a pelvic floor health expert. Is it like you're going every week, or it depends on your situation? Doing homework in between? How long does it usually take to kind of see improvement in general?
To see change. Yeah, that's a great question. And yes, with physio, it's just like any other physio, there's homework. What we do hands-on is just a small piece. It's really that home piece that's going to make the big change. So sometimes even as little as 1 to 2 sessions can be enough to learn some great tailored strategies that you can tackle at home with some home type of routine as well. It doesn't have to be a big, lengthy investment.
Okay, great. Okay, there were some questions that came in beforehand. I know you covered vaginal moisturizers and lubricants. I don't know how much you want to get into nitty-gritty. Someone's asked specifically if you would recommend Gynatrof as a good vaginal moisturizer. Is that a good option? I can't remember what was on your list. I think we're going to be sharing your presentation, but that was asked. And then someone else wanted to know non-hormonal vaginal moisturizers other than Replens, Halogen, and Levina. So maybe give us your take on which brands. Is that something you do?
Yeah, top 3, top 5. There's so many different options out there, and you can really get into the rabbit hole as a lot of new options come out and a lot of things change. Typically, moisturizer, the ones I've gotten the greatest feedback are Gynatrof is one. Repagyne is another great one. that have gotten a lot of great feedback. So ones that do match that natural environment level and don't have a lot of chemicals. The Repagyne, it's also a suppository that you insert into vagina. So it tends to be a bit of a less messy one than some of the other ones. May is a great one. It's all natural ingredients. They've designed it to match the natural environment of the vagina as well. And it's nice because you can get it at Shoppers. It's a little more readily available. Some complaints with that one is if you're someone that naturally runs a little bit cold, you don't run hot, is that it might not fully melt. So some of them can get a little bit messier. And it's really try different kinds out, see what works for you. There's not going to be one that works for everyone. Moisture Palm is the last one I've gotten some good feedback lately.
Okay, excellent. We'll get your list from you and maybe we can share that with everyone. Sort of on a different note. So in the vaginal discharge conversation, we had some questions come in. Can treatment cause more yeast infections? Which I think you covered that off, but someone wanted to know, can you elaborate that? Is it discharge after menopause? Is it different? Is it because it's medically induced from the treatment? Someone asked specifically of tamoxifen, which is, an anti-estrogen therapy, if that can cause excessive vaginal discharge. Is it specific types of cancer treatment or any cancer treatment?
Yeah, so particularly we are looking at the hormone therapies because that's what's really altering the estrogen levels. So anything that is going to be changing that natural environment in the vagina is where we start to see some of those symptoms pop up. Particularly our vagina has this good bacteria that fights off the bad bacteria like E. coli. As soon as that pH level starts to rise, that good bacteria dies off. Now we have the perfect environment for yeast infections, bacteria to grow. Different options that you might use for treatment, like the moisturizers and lubricants, they're going to be great for combating dryness. If they're ones that don't match that natural environment, then we can start to see some changes with that as well. Okay. Not all of them are created equally when you are looking for a good lubricant or moisturizer.
Okay, well, when should someone be concerned? Like, how do you know what's normal? Because that kind of is a question, like, is this normal? Is this something what's the balance?
Oh, for discharge.
This was specifically for discharge. So when should you be concerned? And kind of related to that is, do you need your family doctor to refer you to a pelvic floor specialist? Like, do you start with your family doctor or do you just forget that, I'm going to go to a pelvic floor specialist? Maybe you're not supposed to answer that kind of a question.
So in terms of discharge, I'd say good to have your family doctor on board. There are going to be ones that are looking more into the non-muscle findings that are going on with the vagina. For seeing a pelvic floor physio, you no longer need a doctor referral, similar to any other physio. So pelvic floor physio is billed just the same as a traditional kind of physiotherapy. We often say it depends on your insurance too. So if you have insurance that covers physiotherapy and they require a doctor's note, it's great to go that route beforehand.
Okay, thank you. So sort of a similar question, does urinary incontinence after having kids worsen as you age? And how do you know when professional intervention is needed? I guess it's kind of like your quality of life.
I feel like the number one story I hear is you have kids, you're jumping on the trampoline, and mid-jump, you start to feel something trickle down your leg. So that is a sign that our muscles aren't functioning at 100% of the way we want them to function. Because something is common doesn't mean it's something that we have to live with. And there's so much that can be done. Especially research-wise, there's really great evidence for targeted pelvic floor training and being able to improve bladder symptoms. I think in Britain or France, they actually do cover pelvic floor physio after you have a kid. So they cover about 8 to 12 sessions of the guided assessment, like I was describing on the model, with particular home training exercises. And this is everyone that was traditionally on a surgery list to have that issue corrected. And by the end, 80% on that list didn't actually need surgery. You can see really big positive changes. As we age, it's going to be a little more challenging because we do lose some strength in muscles everywhere in the body. So pelvic floor is not an exception. Just because it's more challenging doesn't mean we can't train and strengthen.
Okay, excellent. That's encouraging.
Never too can always strengthen.
Just looking through. Let's see, I've got quite a few other questions here. Besides local estrogen, what do you recommend for reducing urinary frequency? Kind of related, what do you think of Botox injections into the bladder?
Yeah.
Never heard of that.
Yeah, great questions. So I didn't get too much on the slide, but our bladder and pelvic floor, they communicate really closely together. So our bladder is something that we don't actually have control over. We have control over the pelvic floor piece. So it's the pelvic floor that's creating that closing around the bladder opening. When we have tension in the pelvic floor, we actually lose signals to the bladder, telling it to relax. So as our bladder is filling up, it signals our brain, and that brain signals our pelvic floor. When we have tension, we lose the signal back to the bladder, telling it to relax so it can keep filling up to the very top. So we might only have a little bit of urine sitting in our bladder, but because we didn't get the signal back from our pelvic floor, it's going to feel like you have to go, and you have to go now. So strategies that tackle tension in the pelvic floor, whether it's our hands-on strategies or exercises for reducing tension, they can impact that going very often throughout the day.
Sounds like it's all about balance, whether it's pH balance or muscles like not being too tense, but having tension. Yeah. Would ultrasound work just as well in terms of checking activation and relaxation of pelvic floor muscles? Is that a tool you use in your practice?
So there are different kinds of ultrasound. There's the one that you would do kind of baby ultrasound. There's also an ultrasound called rehabilitative ultrasound. Some clinics are starting to use it as a tool. It can be another great way to give feedback. So we think about these muscles are on the inside. Our brain actually has less connections to these muscles than other muscles in our body. We have a hard time really knowing what they're doing. Most of the benefits of a hands-on assessment is bringing some feedback to those muscles and telling the brain what they're doing. If you're a visual learner, ultrasound can be a great way to actually see what's going on when you're trying to contract those muscles or relax those muscles. It's another good tool to have out there.
Okay, and is that why the visualization helps, because we don't feel as connected to those internal muscles?
Yeah, any types of tips, tricks, strategies. There they are.
Imagine dropping your underwear dropping. That's
underwear
interesting.
Dropping can be a great visual for that pelvic floor relaxing. I have one person that like to picture a jellyfish. We think of a jellyfish coming up and then dropping down, coming up, dropping down, or a flower opening. Anything that draws your brain to those muscles are great tools to add in. I often give some other specific tools around vibrators and vibration can give feedback to the muscles as well. There's lots of different ways you can approach training the muscles.
Okay. Quite a few questions, as I mentioned, did come in just about pain during sex and just how discouraging and frustrating that is. And I see another question here, just feeling so discouraged because intercourse is so painful. Just how much hope, I know you've been really positive about there are things that can be done and there's improvements, but how much hope should someone have? Like, is it realistic? What have you seen in your experience?
Yeah, like it's one of those things that can be extra discouraging, especially when it's not talked about often. We can sometimes feel a little bit alone in our struggle, when really it's more common than we think. Was it nearly 50%? Again, just because something's common doesn't mean there's no hope that we have to live with these side effects from treatment. Combining different strategies, you can start to see some positive change. There's always hope to improve.
Thank you. Now another more technical question. If this is from someone who has triple negative breast cancer and is wondering if Vagifem is safe when you have triple negative breast cancer, so you're not on tamoxifen.
Yeah, so that would be a good question to approach a family doctor about. So right now with the research, they are doing more research into estrogen treatment. So there's been some particularly positive results coming out of using a very ultra low dose locally in the vagina. And in terms of effect on bladder function and all those estrogen decline side effects, they found lots of positive changes. The challenge right now is it's only been a few small studies. There is room to keep doing more research and also looking at longer term effects with the research. The main concern being is typically more with the estrogen receptor positive if that estrogen is leaving the vagina and circulating throughout the body. So it can be something to approach a family doctor or specialist that you're following up with as a good option.
Okay, great. You touched on when we're sort of addressing just people feeling a little bit of feeling discouraged, wanting to feel hopeful. Why do you think these topics are not brought up by physicians?
Yeah, particularly with breast cancer, it makes sense. Our main focus is going to be on the life-saving types of treatments, which there's been such great advancements in that side of treatment. Getting rid of the cancer often is our number one focus, which is important. From there, when we think of breasts, often our focus is going to go onto more of the breasts, and the rest of the body sort of just gets pushed back as secondary problem, secondary problem, secondary problem. Now that more people are living with the side effects, I feel like there has been more of a push or interest in now living well in that post-cancer treatment phase, which does include these important effects on the pelvic floor. More people talking about it, more airtime.
That's what these sessions are for. We're trying to, get the conversation out there. And I think you're exactly right. Our phrase that we use is we're trying to help young women with breast cancer live live better and live longer. And that live better is a big piece of your experience and your goals. So we talk a little bit about shared decision making and how to empower yourself as a patient, and really being able to bring forward to the conversation with your healthcare team your goals and your quality of life and who you are as a person. And that's something we're out there educating around as well. And I think this topic and this conversation is one that's a hot topic for the women that are in our community. So this is really helpful that everyone's getting some questions answered. I see a couple more coming in. How long will I need to do treatment for? And is this something I can expect to work on from now on? Will I bounce back after treatment is over? Okay, so that's like, is this something we should always be a little bit working on just to maintain? Is it like we improve, we have a problem, we improve it, and then as we age, we want to keep that healthy? So it's like kind of like how we talk about healthy habits for life.
Yeah, there's that balance. Homework, whether it's pelvic floor related homework or other kind of rehab homework, not meant to consume your entire life. It is a tool there to help empower you and get over that initial hump or initial struggle. Like anything though, so our pelvic floor is a muscle, just like our bicep is a muscle. If I went really hard at the gym for a couple weeks and then I stopped working out entirely, we are going to see things start to drop off. So it is an important part of kind of a long-term lifestyle change as well.
Okay. So I know, your training, your specialty is pelvic floor health. You probably, I would imagine, when you're working closely with someone and you're learning about them and their life and taking that more holistic approach, you maybe learn dynamics with a partner or what's going on kind of outside of your examination room in their lives. Do you give patients strategies? This was a question that came in. Do you give patients strategies to work with and talk with their partner when trying to find ways to be comfortable in it when being intimate?
Yeah, great question. So I do work very closely with sex therapists as well, which are other great individuals to have on your team. From a physio side, just like we might change our posture when we're working at a desk. Every time I say posture, people sit up nice and tall. So just like we can slouch at a desk and create tension, there's great ways to look at different movements or even look at different sexual positions that might put less pressure on a tight and painful spot and kind of get back to being intimate in a more comfortable way. So again, our strategies, there's lots of different ways to approach it. Everyone's so individual and so different. As long as we're breaking through that pain tension cycle, those are the strategies that we're really working on as a whole team. Everyone has to be on board.
Great. So what I hear you saying is, no, you're not a relationship counselor and you're not going to start trying to counsel the relationship, but you have some really practical strategies that you can help patients learn how to bring up with their partner.
From a movement strategy,
that's what you're saying?
strategy, I am here.
Okay, excellent. Great. I think we answered quite a few of these. I'm just quickly looking up. Just seeing, oops, I'm getting the internet connection is unstable message. We're almost finished. I'm seeing a lot of questions have been answered. I'm seeing, comments just that quality of life is so important. So kind of like a thank you type message. Shauna, I know you've been keeping an eye on questions. Am I missing anything? Do we want to offer, anyone want to put up their hand and ask something directly of Katie while we've got her here? It's kind of looking.
So we do have one more question that's come in through the bottom, and it's actually kind of relevant to and timely to, some of us looking at, potentially more lockdowns, more tighter restrictions, and depending where we live. They've asked, given COVID, some might not feel comfortable going to an appointment in person. Are there online resources that are available? Any recommended exercises they can do from home? So if someone's not comfortable for whatever reason coming into the clinic, what can they do at home?
And I see a related one. Do you take virtual appointments? So
yeah, so the virtual appointments has been a very fun and interesting challenge this year. A good opportunity to get really creative as well. So there are lots of kind of more tailored strategies and tests and things that we can do through a virtual format. That can be a really amazing jumping off point to start coming up with a good home plan and program. That being said, if you're trying the virtual strategies and you still feel like you're getting to this point and things are plateauing, don't give up. If you can go and do more hands-on in person beyond that point, that could be the last little bit that you need. Virtual is a really great jumping off point to tackle a lot of those bigger pieces.
great. This is just my own kind of thought, just kind of in that realm of virtual and Googling things. You may land on exercises on Dr. Google or YouTube, and anything you would warn against. You can get down some really strange rabbit holes.
Down some very interesting rabbit holes for sure. No exercise is inherently evil or typically off limits. If your symptoms are worsening and you're doing a particular exercise, then that might be one to really reconsider or back burner for a while. One of the main challenges with the pelvic floor is trying to figure out, are those muscles holding on to tension, or is it a weakness that you're looking at? And sometimes it can be a combination of both. So if you have tight knots in your neck, and as an exercise, I gave you a million strengthening shoulder shrugs, you'd probably be cursing my name. Rather, a nice massage, getting rid of those tight knots and tension is going to feel much better for your neck than strengthening. And it's the same thing with pelvic floor. It's trying to find what's the right exercise for you in this moment to help with those symptoms that you're feeling.
Okay, great. Well, I just want to say thank you. Thank you to everyone for participating and asking all these great questions. But thank you so much, Katie, for coming here to give us this chat time. I heard your dog barking in the background. That seemed to quiet out. That was just brief, but This is an evening and we just really appreciate, I know you're very busy during the day helping people, and to take the extra time as a volunteer just to talk with us and help spread some important information is very much appreciated. And just again, thanks to everyone for being here. Thank you, Shauna, for always helping set this up and keeping us on time and following rules and all of that important stuff as well. And just we're really grateful, and we're grateful for the community that we've been building through these Ask the Expert events. Rethink definitely believes in the importance of experts and seeking expert advice. So that's why we're running these sessions. It's so important. There's so much misinformation out there. There's a lot of confusion, and these types of events give us an opportunity to connect our community with people who know their stuff. And that's people like you. So thank you. Have a great night, everyone.